So we're moving on to the next brace in Trulife's catalogue, and it's the cash hyperextension brace. There's two versions of this brace. As you can see, there's the sternal pad brace, and the same brace is available in the pectoral pad brace. I'll quickly tell you the reason for the two in the first place, in that the sternal pad brace, all these are flexible for maximum comfort. So the upper and lower plates flex to the maximum comfort, and you would aim for suprasternal notch for the measurement of the upper fitting and adjust the brace so that it was down to the pubic, just above pubis bone here. That would be the length that you were aiming for. And the reason for just above pubis, because if you went lower than that to try to gain more control, you could, but then the patient couldn't sit down. And every time he sat down, he would just simply garrote himself and cut into himself. So the height is, the measurement for adjustment is suprasternal notch down to just above pubis there. And the reason for the two types is that some patients would find that once this is fastened up and adjusted, is that it can be a little bit claustrophobic wearing this pad on a patient that's never wore a brace. And some patients are a little bit sensitive over the sternum area here for the pressure of this pad to fit on. And this is where the pectoral pads would be an alternative fitting of that to do the same job, but takes the pressure over to the sides. So it's exactly the same brace, doing exactly the same job. This brace is utilised for resisting between, as I said, T6 and L2, resisting forward flexion. It doesn't stop side flexion at all. It's literally an AP brace for that. It's a lightweight, multi-adjustable brace. As you can see, there's a vast amount of adjustment on the arms themselves. There's an extra long arm comes with the brace as an alternative to the sizing of the brace. It comes in several sizes from that point of view only. You can either have the standard arm or the long arm if you've got a really tall patient. But you can see from even myself, that would just about do myself at 6 foot if I adjusted that out a little bit. Now, the brace itself is it can be used for long term because it can fit under clothing much more easily than the previous brace that we've seen. The Minerva is more utilised for short term use normally. This can be used on a long term situation because it can be fitted by the patient after it's all been adjusted by one quick release strap at the side, and you can make that strap sit either side, so you can reverse it around so that it can either be a left hand side opening or a right side opening, depending on which patient mobility was better for achieving that. Obviously, in some circumstances the patient would have to have some assistance. Not all cases have patients got the mobility to put on and off the brace. Equally, the posterior pad, as you can see, has got extra holes, and that's simply because the pad can either be on lengthways or horizontal, and the strap fed through for more coverage over that area. And that can be literally for comfort also. Sometimes the patient finds the short version range less comfortable than that, and equally you can grab a little bit more area to give some pressure to by utilising that. So you would sort of gauge the patient comfort versus where the actual issue was with the spine. So you can actually utilise this on kyphosis, osteoporosis, stable vertebral fractures, as I mentioned earlier, post-surgical trauma as well. So it's a very useful brace to use and very easy in stocks. It's a very slimline brace, and the patient can keep these long term. That's why it's useful for degenerative conditions. So kyphosis, osteoporosis, degenerative collapse, that sort of thing. The patient can take this home with them and use it on a basis. It doesn't mean they're wearing the brace all day. It means that the patient might be doing a certain activity that's going to put extra stress on that area of the spine, and they're getting very uncomfortable by, I love to do gardening, but every time I try to do gardening, I'm in trouble kind of way. So you want to keep that patient's lifestyle active and independent in the community. So they take the brace and they wear the brace for once once they're in, if it's not an injury and obviously not wearing it from a stable fracture point of view, they'd wear it solidly for a period of 6 to 12 weeks in that sense and utilise it from the consultant advice. But for long-term degenerative changes, they would tend to take the brace home, use it to gain comfort and learn the fact that they wear the brace before an activity that is causing stress under normal circumstances, and that keeps them out of trouble and keeps them more comfortable in the long term.